How to handle conflicting blood pressure medication advice. When you hear different opinions about your blood pressure medication, it can be confusing. But staying calm and following a clear, evidence-based approach is key to safe management. First, understand why advice might differ. Different medical guidelines from organizations like the American Heart Association or international groups sometimes have varying blood pressure targets or preferred medications. These differences are often based on new research, population risk factors, or individual health conditions. Your age, race, kidney health, and history of stroke all influence what medication and blood pressure goals are best for you. Next, focus on established clinical guidelines. Most guidelines agree on core principles. They recommend using a combination of medications, such as an angiotensin-converting enzyme inhibitor or an angiotensin receptor blocker, a thiazide diuretic, or a calcium channel blocker for most patients. It's important to avoid using two medications from the same class, like to ACE inhibitors, because that can increase side effects without added benefit. Your doctor will adjust your treatment based on how you respond, your other health conditions like diabetes or kidney disease, and how well you tolerate the medications. The goal is to find a balance that effectively lowers your blood pressure to reduce stroke risk without causing unwanted side effects. Involving you in the decision-making process is crucial. Your healthcare provider should discuss the benefits of controlling blood pressure for stroke prevention, along with possible side effects or risks of medications. Your preferences, lifestyle, and treatment goals matter. This shared decision-making helps resolve conflicting advice by tailoring the plan to what works best for you. It's also vital to ensure your blood pressure readings are accurate. Sometimes conflicting advice comes from inconsistent measurements or concerns about whether you are taking your medications as prescribed. Using a properly calibrated blood pressure monitor at home or during visits can help. If you have trouble sticking to your medication schedule, talk to your doctor about barriers like side effects or complex regimens. Regularly reassessing your blood pressure and overall health helps your provider make necessary adjustments. If your situation is complex or disagreements persist, seeking advice from a hypertension or stroke specialist can be very helpful. They can provide expert guidance aligned with stroke prevention strategies. Remember, never stop or change your medication without consulting your healthcare provider. Making abrupt changes can increase your risk of complications, including stroke. In summary, managing conflicting advice about blood pressure medications involves sticking to proven guidelines, personalizing your treatment with your doctor, ensuring accurate blood pressure monitoring, and maintaining open communication. This approach helps protect your health, reduces stroke risk, and keeps your treatment safe and effective. Always seek professional advice for your specific circumstances, and remember that individual needs can vary widely.